Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Excuse me. Good morning. Good morning. Today is Tuesday, December 2nd, 2025. So I got it right. I got it right this morning. Thank you for being in the Java Cafe this morning. Listen, a few months ago, or actually in October, we realized, well, almost a year ago, we realized that the foundation of this platform during COVID, being a public health service, we found ourselves going back to that with a lot of changes and ambiguity and a lack of trust within the HHS and CDC. I was like, it's time to bring your Healthy Java back. And so we are back this morning with Dr. Rick Lee, who is a charter Your Healthy Java member, a avid supporter, and stepped in and took the baton when Dr. Joseph Betancourt left Mass General. And he has been a true supporter, a ally, an advisor in the space of public health, and ensures that we have successfully, since 2022, had our health fair. And so all the wonderful things that we've been giving out, we want to say a shout out to Bayer, Johnson & Johnson, and Agios as well, that sponsored last year's health fair. And Johnson & Johnson have been on for Bayer, I believe, has been 2 years, and Johnson & Johnson has been around, I believe, for 3 or 4 years. And so Dr. Rick Lee has shepherded that health fair. And so we're going to check in with him today, primarily around just what's going on a little bit generally in healthcare. It's wintertime. We have the big three: COVID, flu, and RSV. And I learned some things from him yesterday. One thing from him yesterday. And at 10:30, we're going to have the Boston Waterfront Coalition with us as well. So it's a healthy Tuesday here in the Java Cafe. Dr. Lee, how you doing?
I'm great, James. How are you?
I am doing well. I am in my blue today, which, is opposite of the Java brand, but, I had to. And I almost, if I had time and if I didn't rush, I would have thrown on a bow tie as well.
Well, I got the white coat on for you, and I'm sitting here in an actual clinic space. So just to make you feel like we're actually in the office.
We're official. Yeah.
Dr.
Lee, I have to ask it first, as I do with the mayor and Ayanna Presley. The space in which you move is not necessarily, and I believe it in these times, not easy. There's ambiguity around health insurance. We're still catching up with, presumably, with screenings that people are delayed post-COVID. You don't take the white coat off and go home, and that just by osmosis leaves your head. I have to ask, how is Rick doing? With all due respect, how are you doing? And you can, if you would like, just how are other providers doing in this time where there's a lot of ambiguity going on in the public health space?
Yeah, I appreciate that. I think these are challenging times, right? They're challenging for a whole host of reasons. Number one being, from the top of the administration, and a lot of doubts about vaccines and hesitancy, and really, causing patients to question a lot of things that previously weren't even in question before. So thinking about vaccines, these are really important fundamental ways that we can keep safe. Bring it in a little bit more locally, and we've got issues with health insurance. There's all kinds of questions about Obamacare and Romney Care. Well, actually, I would still call it Romney Care because that was the blueprint for it. But the way that people get insurance in order for them to get health care is clearly in question. And then even more locally, we have a major issue with primary care availability and access, which is true here in Boston and throughout the country, because of challenges with things like reimbursement, but also because of the challenges of being a primary care provider here in Massachusetts. We've had hospitals shutting down, and it's been very difficult for patients to access care. So I think one of the things for us to think about, and one of the things that you and I always talk about, is how do we make certain that people are getting the care that they absolutely need, that is their right, and that is critical for them to get, including things like that, appropriate vaccines, including things in my world as an oncologist, doing the appropriate cancer screening. So we've got a lot of challenges that we're facing in 2025, and I think a lot of these are brought upon us by culture, government, lots of different things that are happening that would take up a lot longer for us to try to unpack.
There's so much that we want to at least level set for the community, and specifically, you are oncologists, have been an advisor to the audience here. Your colleague, Dr. Beverly Moy, who I believe, since we've talked publicly, is in a new role as a director of the Cancer Center.
She has a chief medical officer role within our hospital system. We're in the Mass General Hospital, but the MGB system, and now the Mass General Brigham Cancer Institute. Yep.
Shout out to Dr. Beverly Moy.
Absolutely.
Now, Rick, with all due respect, with everything that you level set for us, did you tell us how you're doing and how your colleagues are doing? You went right into the work.
I know.
It says a lot about you, but
we're under strain. To be honest, we're under strain, right? Because for everything that we do for patients, like everything that I do every day is patient centered, and so when patients call us because they're having a hard time accessing care, getting a primary care doctor, I mean, we take all those things personally because we're trying to make certain that they're getting everything they need. So I would just say for all of us in the hospital system, we are feeling the strain. And I think that we also spend a fair amount of our time talking about misinformation and disinformation, kind of correcting disinformation to the extent that that's possible while being respectful to patients' views. I think these are conversations that we didn't have to have, 5, 10, 15 years ago. Certainly not when I started my career, as attending 18 years ago. So how are we doing? We got our heads above water.
It's definitely something that is a concern for many of our, public health and medical providers. A lot of, I've seen videos and been in spaces, and often when they're describing the state of things, the bewilderment, that is expressed on their face is interesting. And so, Dr. Lee, you talked about screenings. You are part of the Cancer Center there. Where are we with, I mentioned that we were behind, and I learned that from this partnership that a lot of people didn't go into the hospital in 2020 and 21, and cancer screenings are behind. Can you level set for us specifically? And there, we often talk about breast cancer, prostate cancer, and things like that. Where are we generally with prevention and screening? And also, are people getting into treatment, which will at some point lead to, us talking about the importance of clinical trials and diversity in those data sets and whatnot. So where are we with what you're observing there in the center?
Yeah. So as you already mentioned, with COVID, there was a major drop off in screening for various preventable cancers or treatable cancers. And so we saw that happen in 2020, and the catch up has happened to some degree in certain populations and certain diseases. But I would say we're probably still behind in terms of the screening for these screenable cancers. So let's just talk briefly about what those screenable cancers are and what the current recommendations are. So for what I do, I'm a specialist who focuses on genitourinary cancers. So that's prostate, kidney, bladder, testicular cancer. Prostate cancer is the big one. It's the most common cancer in American men. And the current recommendations are to start with PSA, blood testing for a protein called PSA, starting at age 45 for patients who are at average risk. So average risk patients would be patients who have no family history. But people who are at higher risk are those who have a family history and the Black or African ancestry patients, because we know that those are patients who have a higher degree of or more likelihood of actually being diagnosed with prostate cancer and having a more serious illness. So start at age 45 for patients of average risk, start at age 40 for if you're Black or have high risk because of family history. So that's
prostate. I chime in, Dr. Lee. I did my PSA. I got it done. And it's so let me just say, it was a blood test, just regular blood test, and they do it So I just felt well to say to get that done. Now, the other couple of things that you and Dr. Betancourt.
I'm going to get on you the next one. So, but importantly, just for folks to remember, screening is when you're getting tested and you have no symptoms, right? So it's not just showing up because you've got a problem and then they find a cancer. That's not screening. Those are symptoms. These are patients who don't have symptoms. So let's move on to the next one, the other cancer that I know I got to talk with James about, and that's colon cancer. So the screening for colon cancer can happen in a couple of different ways. There's colonoscopy, the camera looking through the entire intestine. There's stool-based tests, blood-based tests, and there are CAT scan-based tests. These are all ways for you to screen for colon cancer. And the current recommendation is to start at age 45, and that's from a couple of large agencies. Stuff for us to remember is that there's a rising incidence of early onset colorectal cancer, and that's why the recommendations have gone from 50 down to starting at age 45. And so we know that there's still suboptimal uptake of screening in these patients. So you guys start at age 45. And one of the things that we learned in our health fairs is that some of the attendees came to my colleagues who are in the gastroenterology group, and were told that they didn't need to be screened for colon cancer when they were clearly in the age category. And so things for us to correct perhaps for our friends in primary care, but also for us to make certain that the viewers, that the people understand that they can advocate for themselves. And that's why I'm going to emphasize the starting point for these sorts of screens. So 45 for colon cancer screening as well. James, have you done it? That's the question.
So I have the referral, and I'm going to. What I promised was I would schedule the appointment before the end of the year. Okay,
I'm going to hold you to that. Let's talk about two other screenable cancers then. Breast cancer. So other major cancer for women. So the current recommendations really start mammography around the age of 40 for patients who are at average risk. There are some variations in terms of those recommendations when it comes to the National Comprehensive Cancer Network, the U.S. Preventive Services Task Force, the American Cancer Society, but it's a discussion that really starts around the age of 40. So I would say for our women in the audience, having those mammograms and being an advocate for follow-up of any abnormalities that may be seen. These have become really, really important for patients to be aware so that they can advocate for themselves. The last cancer I'm just going to mention is lung cancer. So when we think of like the big three cancers in terms of mortality in the U.S., for men, it's lung, prostate, colorectal cancer. For women, it's lung, breast, colorectal cancer. So I'm talking about these are screenable cancers. And it would be important. So for lung cancer, we do screening in patients who are over the age of 50 and have more than 20 pack year history of smoking cigarettes or smoked for longer than 20 years. So what's a pack year? That's a calculation based on how many packs per day do you smoke. So if you smoke 1 pack per day for 1 year, that's 1 pack year. If you smoke 2 packs per day, that's for 10 years, that's 20 pack years. You just multiply. So for patients who are over 50 or over and have 20 pack year history or a 20-year history of smoking, let's just say if you're half a pack a day smoker, but you smoked for 20 years, those are patients who might not meet 20 pack year history because that's just 10 pack years, but that duration also is really, really important. That screening test is a CAT scan of the lungs. It's a low dose CAT scan, meaning low energy. So people are always asking me at risks of CAT scans, do they cause cancer? And I would just say these low dose CT scans at this age category is not going to cause a cancer.
That's one of the things that it's a small thing, but it could prevent someone because, growing up, we were taught that x-rays, then they came up with I think CAT scans were first, and then they came up with the MRIs. And, folks were like, that's going to cause cancer and the big lead things. And so small thing, but it's one of those notes of misinformation that we aim to correct in spaces like this.
That's absolutely right. So we got to make certain that people are getting the tests that they can get, because the key to all of this is actually identifying cancers earlier stage, smaller, so they can be treated and hopefully cured. So I'm actually let me digress if I can about one thing, and that let me just talk about prostate cancer, because that's what I see the most of. And in American men, Black American men have double the death rate for prostate cancer than white American men. So what's at the root of this disparity? Well, a lot of people are studying these sorts of things. But what I can see is that access to care is probably a major source of this issue, because when you look at patients who are in the VA, so veterans, Black veterans and white veterans, and there's a big study that looked at veterans with prostate cancer, and if you look at the groups of these vets, the Black veterans as compared with the white veteran counterparts in the U.S., they had all the reasons that you might think would lead to worse outcomes. These are men who had higher PSA, these social determinants of health that we talk about, such as less education, younger age at diagnosis, lower income. All of those things would have told us that the Black vets would be worse off. But in fact, the Black vets actually had better survival outcomes compared with the white vets, or equivalent. So what does that tell us? Well, if you look at all Americans, as I've just mentioned to you, Black prostate cancer patients have double the death rate of white prostate cancer patients in America. But in the VA system, which is a system where these men who were, in the armed forces, in the military, and then had access to care throughout the rest of their lives, even if all social determinants of health might have indicated they might have worse outcomes, they actually did the same or better. So it's access to care that's really, really important. So when I'm talking with all of you about access to care, do you have a primary care doctor? Are you getting screened? If you're not getting screened, are you asking for screening? That's why I want to empower you with today.
Dr. Lee, to your point there, I wanted to highlight two things from Niecy Williams, which this is a challenge in a lot of spaces. It took me 3 years to find a good PC. I finally found one that cares about my needs and my health. Then she further goes on to encourage people and say, the Java family, men and women, please get your yearly mammograms. I love that she said men, because we've talked about, what's the word, Dr. Lee? Male master. Oh, when men have breasts.
What do you mean, gynecomastia?
That one.
Yeah.
I said gynecomastia. Okay, so I love that she encouraged men. She also said, please get your mammograms. I would have never known I had a mass on my breast if I didn't get my yearly mammograms. I had Niecy, wow. Niecy, you didn't tell us. I had surgery 2 weeks ago and the surgery was successful. Please get your screening. So Niecy, thank you for reiterating what Dr. Lee said there. That was just powerful. And Malaga was saying glad it was called. I thought she was saying she had surgery as well. The access.
And so for the women who are listening, bring these men to their doctors and make sure that they get their screening as well. We are men. We don't go to the doctors that much. Some of us don't get colonoscopies when they're supposed to, right? So look, I mean, we have to do this, as a family, as family members, as your friends and family. We have to advocate for each other and make certain that we take care of each other, because in a time where finding primary care doctors is a challenge. It's tight. The systems are all tight. We have to make certain that patients get the information that they need, and we're taking care of each other.
That is one of the things that is key here. Dr. Lee, we're going to have the Waterfront Coalition join us in a few minutes. I wanted to ask you, though not a pulmonologist and ID infectious disease doctor, I'm sure you talk to your colleagues and you get updates. And what is it? The journal, AJM or something, or journal, or JAM, whatever it is, the American Journal of Medicine or something like that.
Yeah.
Where are we? It's wintertime. We just left the holidays. We now have, I think, a more heightened sense since COVID that, from November till about February, back then COVID was going up. And then a few years ago, there's another big three: COVID, flu, and RSV. We'll end with RSV because you taught me something last night and I was like, oh, shoot. So just in a general 50,000 foot level, can you give us a few things that we should be doing? Give us a level set of what you're hearing. And then what is it that we can do the best ways that we can simply prevent. These are all considered respiratory diseases, correct?
Yep. So, infectious diseases, this is the time, right? In the wintertime, this is when people get sick. And then, the holidays, when people are all getting together, people are traveling, so bringing illnesses from one state to another state. And, it's all one big, mixed up bunch of germs. So I'd say a couple of things. First, you've got to use common sense here. If you're sick, stay away from other people. Don't get other people sick. Second, vaccinations, are really, really important for the right patients. So for things like the flu vaccine, it's currently recommended for all people over the age of 50, or people who are even younger than that with, chronic conditions. It becomes really, really important for your prevention. There are other vaccines that we can think of, things like the pneumonia vaccine. That's really for all patients over the age of 65 or people with certain underlying medical conditions. There's also the COVID shot. This, of course, has had lots of ongoing generated controversy from our FDA. But I think that we all experienced this terrifying pandemic in the last 5-6 years, and understand that the vaccine has really helped us regain our lives again. So I think it still remains very, very important for patients to get their COVID vaccination. And the last one is the RSV vaccine. So that's what James and I were talking about last night.
Yeah, you're going to make me say Rick instead of Dr. Lee. Rick, in all these years, I've had you and others and many on, and we've talked about the big three, and I don't remember ever hearing that there was a vaccine for RSV.
Yeah. So this is really indicated. So in adults, it's really indicated. I was reading about this because this is not really my area, but reading about this, it's really indicated for adults 75 and over, and people who are 60 to 74 but at increased risks for severe disease, people with like underlying pulmonary or heart conditions, lung or heart conditions. It's also indicated for pregnant women ages 32 to 36, people who are pregnant, and also for kids who are at high risk for having severe disease, because RSV is something that happens most often in the pediatric population. But these are really important. I mean, we can talk about other vaccines and the whole controversy about measles vaccines and other things. But for this group today, we should be thinking about the common respiratory ailments that come along in the wintertime. Keep yourself safe. Keep your family safe. I mean, that's what we're doing here today, is trying to keep everyone safe and healthy.
Healthy and safe and healthy is definitely a part of it. And Dr. Lee, we often talk about the relationship between it's all health, but the physical health of the body and how the mind plays a part of that. And I'm going to ask you sort of a different question as we get ready to bring in our next guest. With what you said, that it's, I believe you said, under strain or stressful time for a lot of medical providers. By any chance, in your self-care, do you have any sort of relationship with the Waterfront at all?
I do. I do find the water particularly peaceful, and I think it is a good spot for me to get a little bit of mental reset. I like mountains and I like water, so I'm sort of in between the two. But I think that's just as important for us, is to think about the mental health piece of things. So I'm glad we're kind of juxtaposed today.
Yeah, definitely. I'd like to introduce you to Jason from Boston Harbor Now. Jason, Dr. Lee, Jason, Dr. Lee, works to prevent and treat cancer, and Jason, Dr. Lee, works at Boston Harbor Now. Jason, just quickly say hello to Dr. Lee and let him know a little bit about what you do at Boston Harbor Now.
Sure. Hi, Dr. Lee. It's great to meet you, and thank you for all the work you do and to keep our communities healthy. My name is Jason Rundle. I am the Senior Manager for Harbor Walk Access and Resilience at Boston Harbor Now. And so most of what I do revolves around the Boston Harbor Walk, which is a 43-mile linear park, basically, that goes along the coastline of Boston. And I'm primarily concerned with both access to this space, trying to bring more people who face barriers to accessing the outdoors to the waterfront in Boston, to for all the health benefits that we both know. and also thinking a lot about resilience on our waterfront, especially trying to address flood risk as climate heats up and as our waters rise. We're having more and more intense storms. So working with the city and the state around keeping our waterfront resilient from those impacts. So it's great to meet you.
So important. Thank you so much for what you do. Nice to meet you.
And Dr. Lee, thank you as well. We will be in touch. Dr. Lee, I'll go ahead and say this now. We haven't firmed everything up. But folks, please save Saturday, May 16th, 2026 for is this the fifth? Sixth. Fifth. The fifth annual Joseph R. Betancourt Health Fair, helping the community get the information they need to get and stay healthy. And so, Dr. Lee, thank you. I know you have to get back to patients. Last question. What you got on your feet? Dr. Lee is known for his footwear, everybody.
Nothing special today for you. Wingtips. Right. Wingtips. The usual. Yeah.
Sir, thank you, and we'll talk soon.
All right. Thanks. Bye, everyone.
Thank you. Bye-bye. Jason, thank you so much for joining us today. We are going to talk about what you do there at the waterfront. And then, folks, please stay till the end because he doesn't come on often. Ian Carby, who's a silent storm, him and Tracy, they do a lot with the Coalition for Resilient and Inclusive Waterfront. Ian's actually going to come on the show and come on screen today, and we're going to make an announcement about ways that you can contribute to forming and give feedback about Boston's waterfront. And so, Jason, please again say hello to the audience, and I would like to ask you initially, after your greetings, to describe your utilization of the waterfront in the wintertime in one word.
In one word?
The winter in the waterfront, it's a few words for me. Well, no, it's one word. No.
Sure thing. Well, it's great to be here. Jimmy, thank you so much for having me. I recently joined the Boston Harbor Now team, but I've been living and working in Boston for a few years now and really fallen in love with the city, the people, the waterfront. And honestly, when I think about, accessing the outdoors, I grew up in a place that didn't have such intense winters as here. And so I was used to being able to go outside all the time. And it's been a big adjustment for me, living in Boston for the past 10-ish years and thinking about how can I still spend time outside, get those health benefits of fresh air, and in the water, throughout all the seasons. And so I think when I think about winter on the waterfront, I think about, places that have indoor outdoor. I'm going to do a double word, but it has a slash in the middle because sometimes you want to be able to, get that fresh air, but also jump inside if you're getting too cold. And that's why I think the waterfront is really special because it's an outdoor area, but there's so many community spaces, cafes, restaurants on the water that you can kind of go in and out of. And so I think it's a really great way to stay a little bit closer to where it might be warm, but also be able to get outside.
I'm just thinking about Miami when you said in and outside the water and food. And I'm sorry. All right, let's stay focused. Tell us a little bit about your relationship. You mentioned that, you grew up in a warmer climate. I love how you framed that. You framed that very well. What did you say? Wasn't as intense or something like that. But tell us about your relationship with the water. What brought you to Boston Harbor Now? And then we'll go into what's going on, what's coming up with Boston Harbor Now. I have to say, shout out to my good friend Jay. I love them. They that's the homie right there. So your relationship with water and also what the Boston Harbor Now has coming up and doing. And then we're going to talk a little bit about part of that work, which is, and you mentioned it already, climate change and climate justice.
For sure. Yeah, I mean, I grew up in a coastal town in California, so spent a lot of time on the beach and in the water and came out to Boston for school. I know that you also went to BU, so shout out, go Dogs. And when I came here, I didn't think at first of Boston as like a beach kind of city. It doesn't necessarily have that reputation, but as I was, finishing up school and studying environmental health, I began to think more and more about, how can who I don't have a car, so I can't necessarily drive to New Hampshire or Maine and those kind of like nature areas. But what I realized is there's a lot of open spaces along the coast, beaches in Boston, actually. So, whether it's Revere Beach, whether it's Constitution Beach or Carson Beach, there's actually a lot of open spaces on the water. And I was living in Alston at the time, and I didn't necessarily know how to get to these places. I didn't even know we had harbor islands. And so when I learned about the resources that Boston does have, I got really excited. And I first started my career in access to the outdoors at an organization called Save the Harbor, Save the Bay. And I led their policy work for a few years, and now it's kind of led me into where I am now with Boston Harbor now, in terms of how do we increase awareness that these places exist, and how do we make them actually feel welcoming when folks show up, make sure that there's like amenities that people can use, and ensure that people, feel like whether they speak a language that's not English, whether they have a disability, or whether they're a person of color, they belong in these outdoor spaces just as much as any other Bostonian. And so that's really been kind of the guiding focus of my work. And so since I love to spend so much time on the water outside, I figured that, why not kind of dedicate myself to making sure that the communities that I care about can also get out.
One of the things that we realize, Jason, you can tell us also how you do it, but there are a lot of health benefits. We just had Dr. Lee on talking from a health perspective. Can you talk about some of the benefits around the connection to water utilization? Yes, even in the winter. But I know for me, even if I see water, like I'm looking at this little wonderful background here, and I'm like,
Yeah, no, I totally get what you mean. And that's something I've been thinking about a lot is, so my education background's in environmental health. And so trying to think about how do exposures to things like the outdoors, to water, how do those improve our health, both at an individual level and a community level? I think a lot of us kind of understand, just by thinking about it, that if we're living in the middle of the city, we don't see very many trees or open spaces. It can feel kind of cramped and stressful with all the traffic and all the tall buildings. And when we're able to get out to a beach or a park or the harbor walk and just, even sitting on a bench looking out at the water, even as on an individual level, we can feel right away like, oh, like I can take a breath. You know what I mean? It's more peaceful here. And I think, Boston's a hustle and bustle place, right? Like we like getting stuff done, and we're proud of the work that we do. But I think there's, definitely time that it's helpful to take a step back and just sit and be still. And so I think the outdoors is a great place to do that. And I want to work on, maybe with crew, maybe with Ian and folks like yourself. How do we measure that success? I mean, we can think about like blood pressure going down. We can think about, maybe cortisol, like the stress hormones going down and stuff like that. And it's really tricky to kind of tease out exactly how that's working. But I think a lot of us have felt that way when we're able to go, see running water, even hearing water. Some people even will play that in their houses to relax. There's
the rain,
real health impacts.
It for me, it's the rain. It's anything except the only thing that really doesn't have an impact is running water in the house. I have to admit that I just realized that in real time. Thank you. That doesn't do. I used to have like the little waterfall on the desk. I don't know. It's so peaceful. One of the things, there's this notion around self-care and everything right now that, you have to protect your peace.
Right.
We talked a little bit about the individual impact of utilizing the waterfront, but then there's sort of a macro and communal impact as well. One of the things that is a challenge to that is especially in the times that we're in now. A lot of things are being rolled back as far as policy. We won't get into that. When we talk about protecting our peace and the water being a piece of it, tell us about the work that Boston Harbor is doing around climate justice and climate change.
Yeah, 100%. I mean, I think it's something that's really important to think about in Boston's history as a city is how a lot of the waterfront places have been really, really segregated and only kind of set aside for a certain type of Bostonian, more of a white and affluent Bostonian. And so this isn't going directly into the climate change, but more the climate justice part of what you're talking about here. I think at Boston Harbor now, we're really focused on kind of centering the voices of people who haven't been invited to the waterfront in the past, and really focusing on, what's going to bring people living inland, people, with the barriers that I described before, what's going to bring them to the waterfront in a way that makes them feel welcomed and included there. And I think that's a big part of what we're trying to do when it comes to climate change as well. A lot of us have probably seen the flood maps of Boston, in the next 10, 20 years. It's like, it's coming, right?
No. So it's interesting because the last two, we had two major rains. I remember this summer, and a couple of my friends on Facebook posted right here in, I say Roxbury, but they call it Dorchester. Yeah. There's an inclined plane that you had to consider, the sewer drains being cleaned. But as I'm looking, it's in the Blue Hill Ave area, but there's a dip where that flood is. The street goes down like this a little bit. There's that dip, and then it goes back up. Not forget the maps. It got real just this summer, and so I'm sorry. When you said that about the maps and it's come, and we have to do better, but we're seeing some of the impact. I mean, the fact that it was 61 degrees on Thanksgiving, I loved it. I often say I love these warm days in the winter, but the downfall of that is it's because of climate change. And also thank you for differentiating between climate justice and climate change, because there is a difference.
Totally. Yeah. And I agree with your point wholeheartedly, right? It's not just some map that we're looking at that's like, this could happen, right? Like, we're feeling this now. I mean, and Tenian Beach is flooding all the time down in Dorchester. We see at Long Wharf in the aquarium, we've had dumpsters floating down the street in 2018. Have you seen that video? That's no. Like in the Fort Point neighborhood. I'll send it to you after this. But to your point, I mean, Boston is not like an elevated city, right? Like, I've learned since I came here that when they created the city, they basically just pushed some hills into the tidal areas and filled it up like a couple inches above the high tide in 1800 whatever. You know what I mean? So we're not like, we don't have high areas to run to. And so it can be a little scary and intimidating, like thinking about oh gosh, like, what are we going to do? It's all happening at once. But I think what is really exciting to me about the opportunity is if we're going to kind of band together with the city, with the state, with the property owners along the waterfront and design, a more climate resilient harbor walk and waterfront, we actually have an opportunity to create something that's new with more open space and more what we like to call like co-benefits for people, whether that's, sloping waterfront parks that go into the water that allow us to get some of that elevation gain, whether it's, things like outdoor amphitheaters and community boathouses that, utilize the water that's coming and kind of add benefits to the coastline instead of just building like a giant wall that cuts us off from the water. How do we kind of live with water? And, there will be times when high tides will happen, when floods will happen, and water will come into the city. So we have to think about, how are we either pumping that water out? How are we storing it? But I don't think necessarily we have to be only scared about what's happening on the coast. There's a lot of opportunities to create, really exciting public spaces on the water because we're going to need to change the waterfront. So might as well make it better. That's how I like to think about it. And that's what we're trying to do at Boston Harbor now.
One of the things I wanted to mention, Ian posted who's going to join. Ian, get ready. He's going to join us in about 6 minutes or so. But he did post a hyperlink here in the chat, and it will take you to a PDF about some of the health benefits of the waterfront. Also, please keep in mind that there is an opportunity for you to contribute to some of what Jason is talking about around climate justice, and also, ideas or anything that you have in reference to utilizing the waterfront. So what's coming? I know Boston Harbor does. First of all, Jay and I, we have a joke about spectacle on spectacle. I went to spectacle on spectacle. Then a couple of months later, I was scheduled to have an event on Spectacle Island.
Word.
So I thought that, all Spectacle Island events were going to look like spectacle on spectacle. But we made it happen, and shout out to crew for our event that and we got a big event coming up this June, but we'll talk about it later. And so what's coming up with Boston Harbor now? You all do wonderful things in the wintertime. And yeah, the winter in the water. You can see I'm struggling, right?
No, for sure. It's exciting. And, I'm about a month in here. And so I'm really starting to understand what we do and offer kind of my own thoughts on how we can move forward on these Harbor Walk related things. One thing that I'm personally doing is working with a volunteer group called the Friends of the Boston Harbor Walk. And along with the president of that, Mike Manning, I'm going around to each of the 43 miles of the Boston Harbor Walk. It makes up 43 out of the 47 miles of Boston's coastline. We're doing a really detailed assessment of not only the condition of the Harbor Walk itself, this mixed use path, whether it's a boardwalk, whether it's, paved. We're looking at lighting and maintenance and benches, but we're also looking at how can we access the amenities that are on the harbor as well. And so, as you probably know, Massachusetts has a law called Chapter 91 that mandates public benefits on the water. If anyone wants to build on the water, they have to, provide things like public restrooms and lobbies people can work in with Wi-Fi and plugs, and whether it's a cafe or a community meeting space. All of these things are mandated by Massachusetts law, which is great. But I want to go and really examine, are these things as accessible as they should be? And so we're going to be updating our website that shows all of these different amenities. It's called bostonharborwalk.org. And so it's a map that you can go to anytime you need to use the bathroom, anytime you want to, find a place to work. It'll be updated in a way that it should be a much better resource that people can use. Already we're having, tens of thousands of people visit that every year, but that's something exciting to look out for when it comes to the Harbor Walk.
I'm going to put that link in the comments as well, so folks can check that out in real time. And there we go. So that's information about the Harbor Walk. Oh, there goes Ian. Ian already has it in there. Ian, thank you for co-producing and helping engineering today's show. Ian is actually going to join us in a few minutes. Let me ask you, Jason, and I know you can speak to this. I have the feeling of it. Crew, Boston Harbor now, others, I think it's Pierce Park Sailing and others, Mattapans. I can't think of the sister's name, but there's even along the Neponset Shed, there's a group in Mattapan that does water use equity. When these spaces are created for us to participate and share concerns and ideas, how important is it that we participate in opportunities to contribute when folks like you and crew are working to include people? How important is it that we take advantage of that and participate and heighten up or amplify our own inclusion?
100%. I think that is such an important question. And it really relates to a data study that Boston Harbor Now just put out about waterfront visitation that we could probably talk, a whole other segment about. But we were able to use cell phone data that's been dispersonalized, so it's not like attached to one person, but kind of it still tracks like the movement of groups of people and seeing like where are folks coming from to the waterfront, like what neighborhoods and such like that. And it was really interesting to see that when we look at who is visiting the Harbor Islands, the waterfront parks, and the Harbor Walk, the majority of those folks are white Bostonians, even though the city is majority non-white folks. And so I think that goes to your question about how are we, involving folks of color in planning processes for resilience for these open spaces. And, how are we bringing people to the waterfront and kind of breaking down those barriers that still exist today, right? And so I know that Boston Harbor now has a grant program where we're basically saying, hey, we'll give you some money, we'll provide transportation to the water, and let's have events, that are cultural celebrations that are, specifically designed to make these places more welcoming for communities all around Boston and all around our region. And so I think those kinds of programs are really important and successful in making sure that all of us know that this harbor that we spent $5 billion cleaning up in the 80s is really for us, and we should all be benefiting from living in the coastal city, right? I mean, I know I pay rent and I'm like, it's expensive to live here. So I want to get all of those benefits that come with being in Boston. And I think the water is a big one. And so every time I meet someone, I'm like, hey, let's get our money's worth. Let's get down to the water, right? And not only just enjoying it, but also being part of shaping and designing the future of it.
So you just helped me, and shaping and designing the future is a good segue. Why we actually have Ian on camera today, but you just helped me get over my little winter. Well, you've moved me into a different consideration. Let's frame it like that. Yeah, getting your money's worth, being in Boston, even in the winter, because that cold money still. So, Jason, I really enjoyed talking with you. You talked about participating, and we're getting ready to talk to Ian about kind of an easy way for some to participate in what's going on with the Coalition for Resilient and Inclusive Waterfront. That contributes, as Boston Harbor now is a partner, of the coalition and member. And so, Jason, thank you for being with us. Ian and Jason, I'm not going to allow you two to be on camera, not talk to one another, because I know you all talk and communicate often. So I'll just go in the background for 2 seconds.
Hey, Jason.
Hey, Ian, it's good to see you.
Yeah, great. I love listening to that conversation. And I think you set up nicely to what James and I were going to be talking about with the survey that we'll be sharing a link to. And I'll wait a second until James is back on to talk about the survey. But it just made me very excited. The WAVE study, I think, is so amazing. There's so much great info. I dropped it in the chat as I was following along on Facebook. But I hope people check that out. And yeah, I think there's lots of really exciting things for the waterfront right now.
Go ahead, Jason. My mic was off. We're gonna Jason, did you want to respond? And then we're gonna do this a little announcement thing that Ian kind of teased just 2 seconds ago. But go ahead, Jason.
Yeah, I was just saying, thanks for having me. It's great to meet you, Jimmy, and good to see you, Ian. I think what you said, right now, we know what we want to do with the waterfront. We want to make it more resilient, more inclusive, more welcoming. And now that we have kind of these metrics to understand that better, I think we can dive in wholeheartedly, and we know kind of where the gaps are and where we need to go. And I think things like the crew survey is really going to help us really identify what do we need to do right now, what do we need to do a couple years down the line. And so I really appreciate that y'all are doing that, and excited to support any way I can.
Jason, thank you for being with us today, and I'm sure that we will be in touch soon.
Yes, thank you so much. Appreciate y'all.
Thank you. So this brother from California, when he said I think he said less intense winter climate or something like that. Oh, I was like, oh, he framed that nice. So Ian, we got you on camera.
Yeah, here I am. I'm back.
You had when's the last time you were on camera? This is your third time, maybe, but it's been a while.
I think it's a year exactly. I joined last year with Saloni from our team, who
in December.
Yeah, and actually that PDF doc that I just shared earlier. I know the links don't work well on Facebook. Sorry, everyone.
I do it all the time, Ian. Don't feel bad. They come up as 4 comments.
yeah. I get excited. I want to share so much. But we came on last year to talk about that, so it's good to be back.
So we are back. I've been putting this up for a few minutes. And some people that follow you may have seen it on social media. I've hesitated because I didn't want to drop it until we did it here today with you. But first of all, Ian, please, folks that didn't see you a year ago, please introduce yourself and tell us what we're about to drop. In just I'm going to put the link in the comments while you're talking.
Perfect. I'll drop it here too. Yeah. So hey everyone, my name's Ian Carby. I use he, him pronouns. I actually grew up in Maine, so I did come from the intense winter climate, but I'm a big wimp when it comes to the cold. So it takes a lot for me to get out, but I'm doing my best to get out there, just like you, James. Yeah, so I've been living in Boston here for almost 10 years now, and started my professional career as a physical therapist working in a clinic. Nowadays, I utilize those skills to support the Coalition for a Resilient and Inclusive Waterfront, managing the coalition and hopefully spreading lots of helpful information about all of our amazing partners that you can all find on our website, as well as you would imagine, close to my heart is the health and wellness aspect of blue spaces around the greater Boston area. So takes us right into this survey that James and I and Saloni, my other colleague, put together that focuses on accessibility and blue spaces and understanding, is it easy to get to the waterfront? What are the waterfronts that are close to you? What does health and wellness mean to you connected to the waterfront? And I should say this first and foremost, this survey is short and sweet. It is multiple choice, multi-select, pretty much across the board. Shouldn't take you longer than maybe 2 to 3 minutes. You can take longer, of course, if you want, but I think you could go through this pretty quickly. But it'll give us a lot of really good, valuable information, and in a way to understand how we can best support you with what Jason was saying. With, we want to get the most out of these spaces, but we know that there's we're missing the gap somewhere in there. So how do we do that? And I think this is a great way for us to learn how to connect the gap.
It has been great working on this. We've had a lot of back and forth about, y'all know I'm opinionated, and we really put a lot of thought and intent to considering making it as easy for everyone to fill out, but then also being designed to really extract what it is we need to pass on to funders, legislators, informing the continued work of the coalition. And so I asked Jason that question, Ian, with intent about the work that you do, the work that I do, that Tracy and the Davis system and others do. It talks about inclusion, and it's just, this is yet everyone, just another opportunity to contribute to what we're getting ready to go into, 5 years of work?
Yeah. Yep.
5 years. And we won't say too much now, but next year is going to be a big year for the Waterfront Coalition. And we'll just leave that there before Tracy texts us.
Yeah, we've got some exciting things to come next year, that's for sure.
Absolutely. So Ian, again, let's just reiterate how important it is for folks to fill out the survey. Whatever you want to act like you're Ian, act like you're, well, no, never mind. I was going to say act like you're on a well, it is a campaign.
It's a campaign, yeah, and it's important.
Yes.
So yeah, absolutely. This is exactly, we want to hear from you all, and as you all know, in the digital age, this is the easiest way to get access to understanding what challenges you all have, what's working well, what are areas for improvement. So if you can take a few minutes to just fill this out, throw on your favorite song. It shouldn't take you any longer than the song takes to be able to fill this out, right? So,
yo, out of all the calls we had, we never talked about that as being sort of a play your favorite song and do the survey. And then you're playing your favorite song, you're contributing, and you're talking about Ian, there's a couple of byproducts that come out of doing the survey. You listen to your favorite song, you're contributing to the work that crew is doing, and you leave those few minutes a little more relaxed and knowing that you did some community building.
Yeah. There's a lot of benefits here, right in the moment too. I like that.
Okay. You saw Ian's face. You could tell that Ian, out of all the calls, we never thought about that. So. Yeah. Play a song, y'all, and do the survey, do the survey. We were intentional for those of you that, sometimes, Ian, people do cast me on the TV. So if you're watching on the TV, take your phone out and do the QR code. If you are in the chat right now and active here, we did put the link to the survey. It's hypered, so you can click that link right there. I will convert this into a very short link very soon. And there is another short link as well. I'm sorry. It's also, let me just put this in here. TIN. It's tinyurl.com / is this one case specific too? Because the little thing I use, they get on my nerves.
That's a good question.
It is case specific. Okay.
I'm not entirely sure, but yeah, let's say it is just in case.
Okay. Well, it doesn't look like it hyperlinked, but I'll post it, you all, and trust and believe from now until, what did we say, Ian, right after MLK?
I'd say through January. Yeah.
We'll go through January. Okay. So, but that doesn't mean you all wait until, as long as you do it, but don't wait until the last minute. Play, Ian. It's December 2nd. Play what's her face?
Mariah Carey.
Play that, contribute, and then who knows, this spring you can walk to the waterfront and say, wait a minute, that looks like something that I put or suggested on the survey. So yeah. Okay. Brother Ian, thank you. I will say happy holidays. We'll talk and converse before Christmas, but thank you so much, brother. And please give Tracy my best. And I'm excited about next year. I can't believe it's been almost 5 years.
I know it's flown by. Yeah,
it has flown by. So we're right up on each other with anniversaries. So absolutely, brother. Absolutely. All right. Thank you, Ian. And we will definitely talk soon, brother.
Happy holidays.
Thank you. Same to you. Thank you, man. Folks, please listen. I asked Jason that question. I keep putting this up and I keep showing the link because with so much going on to shut us out, when these opportunities are created for us to participate and give back, not just opinions, but give ideas as well. And I know I said ideas today for about 10 times, and I know y'all are in the background. Idea. Is that better? Anyway, few things just to remind you. 2 shows yesterday, 2 shows today, 3 shows tomorrow. Tomorrow's We Need to Know Wednesday with Mayor Wu. Now I have to shout out Phyllis, Michael, Jessica before she left, and others. The mayor is actually in on the first Wednesday at 10 a.m. So we were able to make that happen. But at 9:30 a.m., we're going to speak with Commonwealth Kitchen. We're going to talk about their holiday gift box giving from a community perspective. Commonwealth Kitchen does great work. They have helped support a lot of entrepreneurs, some of who have been in this space. They've had the whole food truck at Franklin Park thing go on. So Commonwealth Kitchen is coming in with some of their folks tomorrow at 9:30 a.m. At 10 a.m., we'll speak with Mayor Wu. And then at 10:30, did I say that right? 9:30 Commonwealth, 10 a.m. Mayor Wu. And then at 10:30, we're going to speak with Boston Globe Media, Anthony Hightower, about the panel that's taking place on Thursday that really is going to report back a lot of the research and the work that the Globe has been doing around economic equity, financial status of a lot of Bostonians. And so that is taking place on Thursday evening. We'll get more information out about that. So tomorrow, everybody on Instagram and on Facebook, type 9:30 a.m. We'll see you tomorrow at 9:30 a.m. Side note, Union Capital members, y'all getting a lot of points this week. Hour and a half yesterday. No, because me and 2.5 hours yesterday. Hour and a half today because it's 11:04. And tomorrow, y'all probably going to get 2 hours. Which reminds me, Thursday is no show at 10 a.m. Thursday, we are back for GBH Amplifies James Jimmy Hills, host here of Java with Jimmy. That will take place at 12:30 p.m. on Thursday. So no 10 a.m. on Thursday, 12:30 p.m. All right. I think that is it. Please continue to keep Miss Teresa and stand in prayer. Don't forget that 29 days from now or before, we're going to believe that Mother Davis is going to take steps on her own. So I believe that is it. Stands quick recovery. And think that is it for announcements. Shout out to Aisha, Jesus Lord, I'm going to get in trouble. Aisha Miller. She had her big coat drive, a second or third year that she did. It started, I think, just from a post, and now it's a whole big thing. And so shout out to Aisha for making that happen. And I think that is it. And we will see you. Oh, there are a couple of comments. Thank you, Ma. Phoenix, what's up, sis? Good to see you in the room. Don't forget that we'll be sitting with Phoenix sometime around the anniversary coming up with in March. We'll keep you abreast of that. I think that's it. Okay. Tomorrow morning, 9:30 a.m. 9:30 a.m. We'll see you tomorrow.